I welcome one and all. Happy International Women's Day to all of you. On this occasion of International Women's Day, I welcome you all to this very significant and timely discussion on breast cancer, an initiative by Roche supported by Integrated Health and Wellbeing Council. I'm Dr. Asavri Sawant, Public Health Specialist for IHW Council, and I would be moderating the show today. In females, breast cancer is found to be the leading site of cancer and accounts for 14% of cancers in them. Over 1 lakh new breast cancer patients are estimated to be diagnosed annually in India. It is reported that with every 4 minutes, an Indian woman is diagnosed with breast cancer. So, our today's discussion will be focused on creating awareness on this very essential topic to spread awareness on the early diagnosis, screening, risk factors, and other trivial information around breast cancer. To have expert guidance on the same, we have a very renowned oncologist here with us today. I invite Dr. Niti Raizada, who is the Senior Director of Medical Oncology and Hemato-Oncology at Fortis Hospital, Banirghata Road. Dr. Niti has practiced all across pediatric to geriatric age groups. Ma'am, it is so nice to have you with us. Welcome to the show.
Thanks so much, Asavri. Thanks for having me today.
Great. With that, let us start with our engaging session on breast cancer. So, ma'am, as this is for public health awareness, let us start with the first very essential question, that is, what are the symptoms of breast cancer?
So, let's start by saying that all cancers, and especially breast cancer, most of the time don't have any remarkable symptom. It's not like there's a flashing symptom and you come to the hospital. Most of the cancers present in an asymptomatic state, but what are noticeable after some time include lump, which is the most common presentation of breast cancer. Then it could be ulceration in any part of the breast. Then there could be some skin puckering or skin changes noted, sometimes known as pudgy orange appearance. Nipple could have discharge or there could be distortion of the nipple. And very rarely there could be pain. Now all this could be in the breast or even in the underarm area.
So the point here being entire region around breast, if you have any of these signs and symptoms, you need to get checked. With that, can you please explain us what would be the top risk factors for breast cancer? When should people know that something is not right and they should see a doctor?
Asabri, when your first question was what are the symptoms? See, what happens is by the time it's symptomatic, it's already gone beyond a stage where we can manage, or probably where we can manage very nicely. That's the whole importance of screening. When you can diagnose them even at a precancerous level or at a very early stage, sometimes known as stage 0 or stage 1. But what we need to know is definitely our risk factors. And some of these risk factors are modifiable, that is, we can correct them, and some are non-modifiable. So the non-modifiable factors, which we don't have control on, is our menstrual cycle, when it started, that is known as menarche. If there was an early menarche or a late menopause, you may actually have a reproductive life in which you may not have kids, or you may have delayed kids. That exposes you more to the hormone estrogen, and that can be a risk factor. But there are certain modifiable factors, that is lifestyle factors, which include consumption of alcohol, even smoking, obesity, and especially obesity starting early in life. These are certain factors which actually you can modify. Then another non-modifiable factor is genetic factors or genetic history, in which your first degree relative, it could be your sister or even your brother or your parents or your child having cancer. So family history is also a very unique subset of cancer, which increases your risk of having cancer.
Also wanted to know if there are any advanced researches on specific to Indian population, wherein any of the traits that are specific to Indian population have had been a reason for developing breast cancer, if there is anything like that.
So see, all the ethnicity will always have pertinent genetic factors as well. And yes, Indian population also has certain pertinent genetic factors which are very specific for Indian population. We have very small amount of research on. So they are always, what we try to do is, when we have a data which already has been published in the West, we try to find out whether we have a similar data with our Indian ethnicity. So we are collecting those data, and we have small data supporting that, yes, there is a small subset of population which have unique genetic characteristics. Also, unfortunately, in our country, we have an earlier presentation of breast cancer. So if the average age in the West is about 45 to 60 years, in our country, we have a decade early. Early 40s is probably a very common age group in our country. We have most of the patients, even, I mean, in your 30s and 40s presenting with breast cancer. So there are definitely very unique genetic factors in our country, but not all of them are pronounced. All of them are spelled out. Well, yes, we are working on it, and small data does show that our type of our country has very unique type of breast cancer.
Another very important aspect that you highlighted, that there is so much more requirement for many doctors to come up with more researches around breast cancer, so that we can understand all these risk factors properly, and also advise people around these, so that early detection can be made possible. Okay, so let us move on to another question, which would be, does reproductive and menstrual history increase breast cancer risk? As you have highlighted this point, that early menarche or late menopause can be some reason. Can you please explain us a little more about it?
Asabri, as I said, that I mean, see, most of the breast cancer is driven by your hormones, and the hormones include estrogen and progesterone. So the longer the exposure of estrogen, one is it increases the risk of breast cancer. And even if you give synthetic hormones in any way, that increases your risk of breast cancer. Not just that, I mean, there are certain, I mean, when you have a childbirth, actually the exposure of estrogen during that time when you're having a childbirth and subsequently when you're doing breastfeeding, the exposure of estrogen is less. So reproductive life and your menstrual length of menstrual life definitely has a bearing. Early menarche and late menopause. Early menarche means when you have menarche less than 12 years of age, and which is very common today. I mean, we have girls who start menstruating at 9 and 10 years of age, and then late menopause, which is technically called more than 50 or even sometimes more than 55 years of age, has a longer exposure of estrogen. So this is primarily the most important risk factor. Also, one thing I want to tell you is that age is the most common risk factor for breast cancer and any other cancer. So longer age, longer estrogen exposure, yes. If you choose not to have a child, then again, your estrogen levels are probably higher. If the childbirth is later in life, that is after 30 years, then again, the exposure of hormones is higher. And therefore, reproductive life also has a very important bearing. There are small studies which show that even oral contraceptive pill intake has some confounding results. Now, obesity has a very similar output. Now, when you're obese, then your fat causes actually excess production of estrogen. Then again, the risk of breast cancer increases. And then, of course, synthetic hormones, as I've said in the initial part, that if you're on hormone replacement therapy, especially postmenopausal women, those also have a higher risk of breast cancer.
So let us move on to another doubt that I had, which is, we have seen many reports wherein the cows are injected with hormones to increase their milk production. And there have been these reports on the news. I'm not sure how relevant they are, but that the babies consuming this hormone injected milk also have shown to have early onset of puberty and hormonal disruptions. So how true is that it is related to breast cancer? Can you please help us clear this on this one?
I would, I mean, I think I'm not the right person to say too much on it. But yes, there's an excess use of growth hormones, which we all know about, including trying to artificially or increase the production of milk. And to some extent, it is secreted in a milk which is consumed by every one of us, including our kids. And then, yes, the physical dynamics change, the growth patterns of our kid change. We also start, I mean, I somehow feel that we notice that even there's early puberty, and even the height of an average Indian has increased to some extent. Then yes, these things are true. But whether it has bearing on more cancer or not, we have yet to find out.
Definitely, ma'am. We would need so much more research on specific to this topic to say come up to any conclusion which can be, translated. So let us move on to generating awareness on this specific topic, which is breast cancer. Another query that people have in their mind is, do all pains in and around breast region lead to breast cancer?
First thing is that pain is generally not a sign of breast cancer. And very often, breast pain is known as technically mastalgia. Mastalgia is more related to your menstrual cycle. Around periods or just prior to periods, having breast pain is very common. And when you have it month on month, it's known as cyclical mastalgia. So first, we have to rule out whether it's just cyclical mastalgia related to your menstrual cycle or immediately peri-post cycles. But if it is persistent, if it is for a very long time, sometimes more than 3 weeks, this is called as any long term pain, it should be investigated. And also, very advanced malignancies can have pain. So, routine malignancies won't present as breast pain. Cyclical mastalgia is what it is. But if there is any prolonged pain, then get yourself investigated.
I also wanted to know how common is breast cancer in India. We have seen all these stats and numbers, but in your day-to-day practice, how would you portray it as? How necessary is for us to, generate awareness on this issue, and how common it is in nowadays in, working women of the modern age?
Actually, you gave very nice statistics. And let me sum up by saying that 1 in 9 women have a risk of cancer in general. So imagine with a 1.4 billion population, if 10% of women have a risk of any cancer, it's a huge, remarkably huge number. Then what we have to know is if we put both the gender combined, men and women combined, even then breast cancer is the most common cancer. So in our clinical practice, we have every oncologist practice, breast cancer is the most common cancer. All of us need to be updated about breast cancer. The studies around breast cancer also across the globe are the highest because that's the most common cancer. So we need more and more research to make ourselves better and better every time. And then what we have to know is that if there are in 100 cases of cancer in women, 26 will be just breast cancer. 1/4 of all women cancer are only breast cancer. 1/8 of all cancers across the country is only breast cancer. And it is also one of the most common cause of cancer related death, especially in our country. I mean, I don't want to call ourselves resource deplete countries, but yes, we are developing countries, and there are quite a few people who don't have access to good healthcare system. And those are the patients who probably are affected most. So yes, there's a lot of gap. And you also asked me about working women. Actually, that's a very interesting perspective we have, especially because we practice in urban areas, and Bangalore also is a hub of breast cancer in the country. And what we know is that awareness, like in these platforms, have revolutionized the way we think. And because of awareness, we get a lot of women of early breast cancer who are working women, who read, who actually see a lot of stuff, and therefore they are aware and they come with very early lesions, sometimes screen diagnosed and sometimes very early lesions. So the pattern in the past 1 or 2 decades has changed a lot, and we now often see early breast cancer as well. I mean, a couple of decades back, we 70% would be only metastatic or advanced stage breast cancer. But now, because of education, awareness, knowledge, I mean, not just cancer related awareness, but generally education amongst women has increased. And that leads to women coming earlier for detection of cancer.
Another very trivial aspect that people are not aware that breast cancer affects men as well. So can you please highlight on that aspect, and if there are any differences for breast cancer in females to breast cancer in males? If there are, I am not sure. So can you please help us with that?
So, when you have a chest wall ulceration or lump in a male as well, you should investigate for breast cancer. If 99 women are affected with breast cancer, there's one guy who can be affected. 1% is the incidence of breast cancer in men. Male breast cancer is also seen. And the difference is that if a male presents with breast cancer, there's a very high chance that they could have a hereditary or familial breast cancer, interestingly. Unlike women, in which only 10% would have a familial or hereditary breast cancer, a male breast cancer should generally always be investigated to look for hereditary characteristics. The hormones which we use for male breast cancer are also slightly different, but by and large, treatment techniques remain the same.
And I believe that when women are suspecting that they might have breast cancer, they do not feel very open to go to an oncologist straight up. They usually go to a gynecologist or their local physician. So in your opinion, how essential it is for all the gynecologists in the country as well as general physicians to be able to detect signs of breast cancer so that they can refer the patient to an oncologist for better treatment?
Sabri, again, a very relevant question. See, there are two things in this. One is women don't come at all in the first place. Or if they come to a physician or gynecologist for another thing, they sometimes are diagnosed because they say there's some problem here, and then they start checking. So educating, especially medical fraternity, is the first thing. And also sometimes the people who have been trained, who actually are currently practicing in smaller places, also probably don't have very high exposure to oncology. So educating medical fraternity starting from early days, like MBBS days, is very important. It's probably the key. And all of us also probably need to make more talks in more association meetings where we can meet more medical fraternity and tell them that this is a curable cancer, and these are the ways of diagnosing them. These are the ways in which you don't delay signs and symptoms of cancer and diagnose them at the right time.
So, how often should the breast cancer self-examination should be performed? And even before that, at what ages the screening for breast cancer is necessary according to different age groups?
So a very easy formula which what all of us can use is, in your 20s, start a self-breast examination. And self-breast examination should be once a month. It should be at a time when you're not menstruating, because as we discussed that there's something known as a cyclical mastalgia, or sometimes even fullness and pain in breast during menstrual cycle. So it is good to examine your breast post your menstruation, have generally an approximate date fixed, and once a month self-examination. Look for a good YouTube video in which both the breasts are examined with the flat of your fingers, and also your underarm should be examined and your neck should be examined. So this is about self-breast examination. In your 30s, start with a 6-monthly clinical breast examination. Go to a clinician and get yourself examined. Also discuss your history. If you have a family history of any type of cancer, if you have had some unusual problems in yourself, so your clinician or your doctor can analyze those issues and put you in a standard risk or a high risk category. And from your 40s, generally on your 40th birthday, start doing a mammogram. Again, as I said, that in our country, the breast cancer happens quite early. I mean, a decade early than the West. So as per Western guidelines, most of the countries, Europe have a different guidelines, America has different guidelines, American Cancer Society has different guidelines, and some start mammogram at 40, 45, 50. But in our country, starting at 40 seems to be a standard good practice. And every 1 to 2 years doing a mammogram is right. Then there are certain other things that for a younger, sometimes the younger breast, like 40s, your breast density might be higher, and mammograms sometimes required to be correlated with an ultrasound breast. So again, talk to an oncologist whether an ultrasound breast is also required at the same time. If you fall in the high risk category, like if you have a genetic risk and your mutations are actually positive, doctor would advise a blood test of the member in the family who's affected or you. And if you're positive, then sometimes even an MR mammogram or an MRI of the breast may be required.
Another very trivial doubt that we had is, if we have family history of any chance, how different would the screening protocol be from somebody who had not? And also, can you please explain the meaning of family history? To which level in family would people be aware of? I mean, I'm not sure if a very distant and far off aunt has had breast cancer, if that would have any effect or not. So can you please explain us both these things?
So, Dr. Zabi, one thing is family history does not mean only family history of breast cancer. It should mean family history of cancer. So when you have a history, one is what data points we are looking for. What is your degree of relation to that person? First degree relatives means your immediate relative, that is your parents, your kids, and your brother, sister. Whether it affected first degree relative, whether it affect one type of cancer affected yourself. So if you have one cancer and now you're getting treated for another cancer. Second degree relatives are the relatives beyond the first degree. So if your grandparents or your first cousins, they fall in the second degree relatives, and then they are third degree relatives. Second thing is that what is the age of their presentation? So if I had a family member who had a type of cancer at 80, now we know cancer is a disease of aging. So certain type of cancers are also just age related. And if you had a member who had a cancer at 75 or 80, may not actually be a relevant family history. In summary, go to your doctor. If you know details of all the family members who had cancer, what age and what type of cancer they had. That makes all the sense. Get your family history evaluated, and if your doctor feels that it's a relevant personal history, means you had a type of cancer in childhood or early age and now you have a second cancer, or you have a relevant family history, generally means that one first degree relative, one or two are affected, or more than two second degree relatives are affected, and so on, then they will ask for either testing of that member, index member who actually had cancer, or if your doctor seems thinks it's relevant, they will get you checked, and your checking would be either a blood test or a saliva swab. And when we get this check, it is checked by a method called as next generation sequencing. We find out if you have relevant mutations. And if you have relevant mutation, even then they are categorized as they are high risk mutation or they are low penetration mutation. And only if you have a certain type of mutation, you need more than normal testing. Otherwise, you don't even need more than normal testing. You may actually just do regular screening, or you might do high risk screening when you actually fall in the high risk category.
Are all benign cysts cancerous? That has been a very major doubt that people have.
Sorry, benign itself means non-cancer. So cyst in the breast, if you have breast cyst, most often will be just related to your hormones, again related to your menstrual cycle, in which there's some dilatation of the duct, which is called a cystic lesion. Now, most of the time, it's just a change in the body. It's known as fibrocystic change or FCD, and they are just changes in your body. They are not even called a disease. So often, if you have a lesion, again, get a decent breast oncologist to see you and examine you, and then also correlate with the necessary investigation. If an ultrasound is showing that this is cyst, however, that cyst looks unusual, like it's a complex cyst which requires investigation, or your age is on the wrong side, or you have a history which makes it a little more doubtful, then it will be investigated further. Otherwise, it's mostly non-cancer.
Thank you so much, ma'am. So another thing that people often wonder is mammography painful? If they were to get any of these tests done, would it cause excessive pain or something that they need to go beyond or take separately time from their busy schedules to get it checked?
Yes, I mean, you have to design a time. You have to give some time to yourself, at least once a year. Have a designated time in which you'll get yourself investigated and then, of course, tested. So, the conventional mammogram causes a few seconds of compression of the breast. So, it can be slightly painful. It can cause a little bit of breast discomfort. And again, should be done generally post menstrual cycle when your breasts are not already tender. Taking sometimes a pain medication may help, like an hour prior, just taking a paracetamol or anything which is a safe pain medication may actually help. And then, of course, being prepared helps. I mean, we know that it's a small thing, but for a larger cause. But there are newer methods now, the digital mammogram or tomosynthesis. These are methods which actually they acquire images at a very quick speed, and therefore the pain is much less.
Thank you so much, ma'am. So another doubt that people have is, would smoking be related to breast cancer? If I'm a smoker, would that lead to a breast cancer in future?
Oh, the answer is yes. I mean, active smoking, you yourself smoking, even passive smoking or secondhand smoking, if your partner is constantly smoking or you're in an environment where there is always smoke around, all that can affect. And it's known to be a risk factor for breast cancer. Not just that, even hookah and any other type of alternate things also can increase your risk of breast cancer. And now, of course, all of us have seen women smoke more often. I mean, men are more convinced to actually withdraw, but there are certain other incentives for women to smoke. So it's very important to educate them. That's an important risk factor.
Thank you so much, ma'am. So now let us move on to the treatment aspect. I am very sure that people are aware that treatment differs from person to person and it varies from case. But what would be the general different types of treatments that people can get advised for breast cancer that are available?
So, Asabri, when we have a diagnosis of breast cancer, mostly the diagnosis is either by a fine needle test or a biopsy. That is a large needle test. It's known as a true biopsy. It also tells us what is the subtype of cancer. And then we do some risk assessment, like we do ER/PR, HER2 testing or KI67 to find out how aggressive or what is the characteristic of that tumor. Based on that, we all subspecialists sit together, including an oncopathologist, an oncoradiologist, and medical oncologist, surgical oncologist, and radiation oncologist. Because we know that most of the breast cancer is a multimodality treatment. It's not one type of treatment. It requires all subspecialists to give advice on the treatment. So, what are the type of treatments that can be offered? Well, based on the characteristic, that is based on ER/PR HER2, we could actually ask for surgery upfront, or we could ask for chemotherapy upfront, or we can ask for chemotherapy or biologic therapy upfront. So the modalities could include chemotherapy, biologic therapy, hormonal therapy, very rarely immunotherapy, surgical treatment, including breast conservation surgery or mastectomy, and of course, radiation therapy at some point in time. Later on, for hormone expressing tumor, hormonal therapy may also be required.
Also, another question that people are very concerned about, that would there be any major side effects to chemotherapy, as generally portrayed in many different platforms, especially Indian cinema, not to point out directly, but that people going through chemotherapy lose all their hair, turn old very rapidly, are very frail and fragile. I want our specialists to highlight how relevant or non-relevant that is, and how possible surviving a breast cancer would be in realistic scenario.
The basic theme when we talk about all this is, what are our objectives when we treat the patient? And when we are talking of breast cancer, again, as I said, it's a very, very curable cancer. And if most of the time when it is not curable, it's still very treatable. And the treatment can result in good results for several years, including decades. Even an advanced stage breast cancer can survive for decades. I mean, they can have a survival for 10 year, 12 year, 15 year. So always remember that, understand the goals of treatment with your doctor. Sometimes the goals may be, if the goal is curative, the treatment may be more aggressive. So it is a short time side effects for a long term gain. Always things are decided based on what are our output or what are our end results. If it is a palliative treatment or if it is a treatment for advanced disease, sometimes only tablets are given, and hormone tablets. They may not cause too much of side effect. And they actually you may look absolutely normal or absolutely good. Chemotherapy, your specific question was, what are the chemotherapy side effects? Well, they are short-term side effect and they are long-term side effect. So short-term side effect for certain type of chemotherapy includes hair fall and can cause nausea or change of the way your taste may change. So you may not like what you normally do. And sometimes even nail changes or even skin changes, your pigmentation. But all these are temporary changes. If you have hair fall or if you have pigmentation of skin, that is during treatment. And it may occur after some time of treatment. It may actually go off after stopping treatment. There are certain long-term side effects also which we have to note. So we do an echocardiogram at baseline and then we repeat a cardiac assessment later on to see everything is fine or not. So there are short-term side effect, long-term side effect, and there are drugs which are modified now to suit you better. They are good supportive care medications so that the side effects are more. But if your long-term results are good, I think always discuss with your doctor than deciding, well, chemotherapy is very toxic and I would not take it.
We just needed that. Can we also discuss on, if the patient has undergone breast cancer treatment and has completely recovered, can she breastfeed safely afterwards? Is that possible?
This is another very interesting topic, Asagri. It's known as people living with cancer who have had cancer in the past, survivors. Well, a breast cancer survivor can actually have kids in future, but again, you have to discuss with your doctor when is a safe time, how much, and then yes, they can breastfeed. So if you have had cancer in one breast, the other breast is okay. And moreover, even that breast, if there's a breast conservation surgery, then yes, breastfeeding is possible.
So, what would be your key takeaway message to all the viewers watching this show on International Women's Day?
The basic, I think all oncologists just preach awareness. And that's what I'm sitting here to say, that yes, be aware of yourself, go to a doctor regularly, trust a healthcare system in which you can probably visit at least once a year for getting yourself screened and evaluated. Not just for cancer, for most of the health conditions.
So, with that, we wrap up this very interesting and informative session on Women's Day on awareness on breast cancer. I'd like to thank Dr. Niti Raizada for taking her valuable time from her busy schedule. And I thank Roche team for taking up this initiative for spreading awareness on this very critical and essential topic of breast cancer. With that, I wish you all a very happy Women's Day.